Hi, today I'm going to be measuring Zorba's forelimb range of motion. He is tied up because I can't get a handler due to the coronavirus pandemic, but he should be safe and will stop if he doesn't like any of the movements. So to begin with, I'm going to look at the distal interphalangeal joint. So at this joint we've got a degree of flexion, extension and rotation. I'm going to then come up to the proximal interphalangeal joint and again look at flexion, extension and a small amount of rotation, but it is difficult to quantify that. I'm then going to look at the metacarpal phalangeal joint, at which I've got flexion and extension is measured in standing due to the suspensory apparatus limiting this as a passive movement. Then I'm going to be looking at the carpus. So this is full extension of the carpus, so that's how I'd measure that. And then for flexion, I'm going to lift his foot up again, boy, and bring it up into full flexion. This is limited by soft tissue approximation, so that's full flexion. Now I'm going to look at elbow flexion, so bringing him right up into flexion there. And we'll come back into extension. But again, this can be assessed in standing. Then I'm going to look at the glenohumeral joint, so here. So again, I'm going to pick his foot up, and I'm going to bring his shoulder into extension, and then back into flexion. Good boy. Zorba's not quite sure about having his shoulder brought back into full flexion, so I'm not going to force it to the end of range. Now I'm going to look at shoulder internal rotation and external rotation. I'm going to bring him into abduction and adduction. Good boy. So the next range of motion I'm going to look at is scapular range of motion. So I'm going to be eyeballing the dorsal border of the scapula and looking at it through elevation and depression. Elevation there, and depression there, on the top of the scapula. While I'm here, I'm going to look at.
So here I'm just bringing the limb into protraction, so it's whole limb protraction and then bringing it down to come into contact with the floor, which he doesn't have any problems with. I'm now just about to assess retraction of the limb, so get Zorba to pick his foot up again and then bring the limb into retraction. He was a little bit reluctant at first, but once he was happy with this, we got the foot down to the floor.
So I'm just going to measure carpus flexion using my outcome measure, which is a goniometer. So I'm going to pick Zorba's foot up. I'm going to bring him to full carpus flexion and place my goniometer. Put his foot down. I've got 145 degrees of flexion there, which is really good. So Zorba showed no real pain responses in response to any of the range of motion testing. So I'd be happy that there's no problem with range of motion with him. I'd obviously compare it to the other limb to get a thorough assessment.